Hi, everyone. Welcome back to the third webinar in our series on behalf of Connected Healthcare Solutions. So this one is regarding creating your critical access hospital annual review. And hopefully, again, down and dirty, nuts and bolts of a quick guide to success. All right, so this is me. I'm not on video today, but this is what I look like when I'm all cleaned up. I am the Vice President, Training and Development person for Canopy Associates. I do a lot of consulting and education for small and rural hospitals. So today's objectives. Again, understand key components to meet the State Operations Manual on the CAH review. Remember, this is SOM's Appendix W. Create a tracking tool and gap analysis for some of those metrics that you're looking for. And then looking at some of that CAPS data and how it impacts both the department, if it's available, and the organization. So, but first, let's start with what we know in our State Operations Manual. When the State Operations Manual came out in 2/21/20, there was a lot of red in it, and we're going to go through a little bit more of this down the road. But one of the things was the periodic evaluation. And in the guidance as it currently sits, it states the CAH carries out or arranges for periodic evaluation of its total program. The evaluation is done at least once a year and includes a review of, in which we'll go through. Now, rumor has it that this was to be changed to biannually as of March of 21. So that time has come. However, the State Operations Manual has not caught up to it. So what I'm telling people, yes, it still says annually, even though we know it's going to change, but this is a great year to get a really good skeleton and foundation built for the years coming. So why do we do this? Well, truly, the purpose of the evaluation is to determine whether the utilization of services was appropriate, that we did what we are deemed to do and were established by guiding us through policies and procedures, and we adopted and changed any procedures or anything that needed to be changed during the course of the year. So with that, our utilization of services includes at least certain metrics, and that's the number of patients served, volume of services. So when you start to really look at your annual review, and we're going to talk about where to start here in just a minute, start asking questions such as, how do you know that your program evaluation includes a review of all your services? Can you describe all of the services you provide and the number of patients served, volume of services provided, when you start looking at like what you did last year as compared to what you're doing this year? So the representative sample must include, that review of active and closed records. So when we start thinking about that, well, how many do we know what we are to do? Guidance actually tells us no less than 10% of both active and closed patient records. So again, you have to determine how many you've seen, how many patients, throughout the course of the year to determine that number. So here's where we really start to get into the nuts and bolts. How do I get started? First, develop a team. This is not a one-person task or job. Now, one person may be the collector of all the information and pull it together into that written plan, but it does take a team, and create an outline of what should be included. And you're going to see at the end of this slide deck, the attachment that I have that goes along with this PowerPoint presentation of a gap analysis tool. It is in a Word document, so you can play with it, change it all you want, and you can write on it. So hopefully, if it didn't come in a Word, please shoot me an email, Angie@canopyassociates.com, or send it to Lance, who is hosting this webinar, and his email will be at the end, and we'll get that to you in a Word. So establish that gap analysis tool, the worksheet and template that has assigned responsibilities, a time frame for completion, and notification to the team of any roadblocks or barriers or difficulties in completing tasks. And the reason I put that in there was we actually had a hospital, and it's been a couple years now, that had a person that was doing their annual review, and she was pregnant and she went into early labor and she was out for 3 months. And that really, created a block for them of, challenges and getting it completed. Now, luckily, surveyors weren't in during that time frame and they were able to get it done. But again, you don't want that to happen. And then, you're going to pull it all together and prepare your annual report and present it to the appropriate bodies. Typically, the board of directors or governing body are the ones that have that final approval, and that is typically presented by the CEO at that level. Now, when we are talking about the team, I highly encourage you to have several people on the team and give them last year's annual review written plan. And the reason I say that is because we want to look back. What did we have before? What can we build on? And where do we want to go for this next year? So our annual plan outline, there's a typical process. This isn't written anywhere. This is just what I have seen and, kind of deemed as best practice. An executive summary, the volume and utilization of services that is required, revenue and expense analysis. And then we have our audit of active and closed medical records, again, 10%. Our healthcare policies, things that were updated, evaluation of services. This is that QAPI program. And again, that's very new. That was new in 2120 in the updates. So again, if you want more information on that, we're going to go through it, but if you need more, just holler. As well as infection control, antibiotic stewardship, and then your department or committee reports. And then a summary. If you didn't do an executive summary, a lot of people put a summary in at the end. Others put the executive summary so they don't have to. And you may or may not include an appendix depending on how you build your plan. So in our executive summary, what should be included in that? Does the CAH program continue to meet the needs of the hospital and the community? Now, this isn't your community health needs assessment. This is just, looking at, okay, are we meeting the needs? Where were services added, changed, or removed? And we definitely know that this is being changed because we were all impacted by COVID. And what happened last year? Can we show that fluctuation? And when we go into further data, I'll talk a little bit more about this and showing all the trends and the challenges we had to overcome. What is the scope of care and has it changed? What improvements have been made in the last year? Did we receive any extra grant dollars and how were they utilized? Maybe for implementing new infection control procedures because of COVID, changing out carpet to something easier to clean on the flooring. Are there any new pending services that might be coming in the next year? Did we enhance our telemedicine services? What impact or opportunities are still kind of incomplete? Maybe we need to have more opportunities for improvement. So here's just an example of an executive summary. Again, very simplistic. It quickly talks about it as far as what they did, the things they looked at, the key metrics, and what they were doing moving forward. Here's two other examples on how they started with their plan and their review. It provided some positives as well as opportunities for improvement. And I like this. I like this look. And, I like that it's just kind of bulleted out. It's not a robust paragraph after paragraph reading. It's actually, hey, look at what we've done. So again, these are just for example purposes. So again, C-1026 has some great questions and guidance to think about as you start looking at your volume and utilization. So again, you have a team. Ask the team, who's going to be assigned to each of these. What is that breakdown of your payer mix? And typically we already have all of this collected. We just have to do it for a year's time. And then the volume of patients. What types of patients did we have? This is a great way to look at, did we have a swing in, inpatient to OBS, looking at our transfers, which we'll talk about here in just a minute. Our average length of stay, did it change? Did our swing bed population change more to the medically complex from the rehab that we used to have, more frequently? And then how many stayed above and beyond that 96 hours? Are we looking at that stay? So looking at our transfers, the number of transfers from inpatient or to a nursing home, how many went out of our ER to a higher level of care? Looking at our ERs left without being treated. And this is one of those that we're also measuring in MBQIP in the outpatient domain in the MB-QUIP categories. Looking at our ER visits, did they increase because of our COVID year as compared to prior, or did they decrease because patients didn't want to come into the emergency room? Again, just giving you some ideas of where you can go. Looking at, how you put this all together. It can be bar, it can be line graphs. Again, it's kind of up to you what's going to work best. So, but I do want to say, really include a little bit of narrative with the graphs. Graphs speak volumes and can show, and especially if we put a trend line with them for looking at it over time, but we definitely want a little bit of narrative to demonstrate that we really analyze the data, and again, when we look at this, we can see where the spikes were, and if we do it, on that line graph versus bar graph, month over month. But I also like the year over year, so we can demonstrate, did we go up, did we go down? And then next year, or now the year we're in, we'll definitely demonstrate a change as we start to come out of our COVID era. Some more examples looking at, how we can use color and the graphs and the tables, pie charts versus the tables, and some bullet points, really just gives us a picture of what really happened. And then our revenue and expenses, some things to just kind of consider, our inpatient and outpatient revenue, what kind of shifts did we see over the last year, our operating expenses, especially during our real high influx of COVID. Some areas experienced it very early on, others experienced it very late. So we can see that uptick and change of when things occurred. Salaries, benefits, grant funding, definitely focus on some of the grant dollars we received and demonstrate the value that they provided us as small and rural hospitals, critical access hospitals. Our technology and capital improvements, especially when it comes to telemedicine, and what we were able to enhance. And then any trended, audited operating and net income results. All right, chart audit time, no less than 10%. I can't stress that enough. So, and it should state that in your narrative of what you did. So when we think about this in the state operations manual, this was not changed. This is what the questions are listed that a surveyor may ask us. Who is responsible? How are they selected? And are you ensuring that a sample of records is representative of services provided? So if we do a lot of pneumonia, COPD, CHFers, not a lot of knees and hips or anything like that, then are we getting that representative sample? And then what criteria are utilized in that record review? How do we do that record review? And again, looking at, this is what we do when we do our record reviews. Consider creating in that checklist of what we want to include. Any strategic improvements to note in the narrative or data of what we had accomplished during this year? Did we change out some of our EMR systems? Did we enhance them through informatics so we can query and review our charting a little bit more stringently? Again, what did we do that can contribute to change or the evaluation of the services that we did and provide? Again, just some examples. I think I have 2 of them in here. This one is, very nice, very bulleted. I like it. It's simple, it's to the point, and it has some narrative right along with it. Here's 2 more, looking at, some bullet points in the departments, as well as, a table of MD randoms and criteria reviews, CRNAs, how many and who were reviewed. And I like that it shows a little bit of over time as well. Policies and procedures. More often than not, when I'm looking at annual reviews, I see this as an attached appendix. Very simple to do. When you have your team together, these are the questions that you could potentially ask. What evidence demonstrates that they are evaluated, that they are part of the annual evaluation plan, that we've done them completely? Patient care policies are reviewed biannually, So looking at that, when does that occur? Was it this last year? Was it the year prior? Is it this coming year? Again, just to kind of look at that framework. There should always be a little bit of a narrative. I like narratives. It doesn't have to be detailed. It can be, bulleted, but I do like a little bit of narrative to say, hey, we really did analyze this. We looked at it. Definitely look at what kinds of policy changes came about because of COVID, our infection control practices, our housekeeping practices, anything we might have had to change at that time. Here's some more examples of things that happened, in looking at policy review schedules. You don't have to list out every policy. Maybe we started Policy Tracker or Policy Tech, and implemented that to be more on task and on target for compliance. Looking at our administrative and the various departments, who had what done. It can be very simple. An evaluation of services, justification of us as a critical access hospital, and the utilization of the services that we provide were appropriate. So again, ask your team how we do this. How can you describe this? What can you describe? Sometimes it's good just to ask them, what kind of services do we provide? What we know as administration and what is written might not be what is perceived, so by the rest of the staff. So we want to look at that and say, okay, what services do we provide? And what have we changed, added, deleted, revised, moving forward? And then during this annual review, did we identify some new opportunities that we can, make note of as our opportunities for improvement that will be moving into this next year? QAPI, again, this one's a little bit on the newer side. We must have an effective quality assurance program that evaluates the quality and appropriateness of diagnosis and treatment furnished in the CAH and the treatment outcomes. So again, your QAPI program must include ongoing monitoring and data collection. How we do that, our problem prevention, identification, looking at corrective actions, how they were implemented and how they were evaluated, and that we are doing this on a continuous basis. So we want to, think about how we do that. A lot of times I suggest, because the QAPI program also is annually currently, but do that first before you do your annual review, because I think a lot of this is covered in your QAPI plan. Your QA committees and reporting structure, some scope and methodology, the whole organization of the QAPI program. What does it look like? A review of our services under contract. I can't stress that enough, that we are evaluating them. What quality indicators did we do as an organization wide, along with our strategic plan, our scope, our vision as a hospital, our improvement projects, not just departmentally, but globally as an organization. Are we reporting to any outside regulatory bodies? And then obviously our patient satisfaction should be included. Again, here's some examples, from various ones I've looked at, just kind of evaluating what works. And then here's a couple others that, really kind of just the down and dirty. Hey, does this make sense? What are we doing? A quick graph, quick visuals of what we've done. And then our infection prevention and control and the antibiotic stewardship. This one, there's a whole section. Go through each line on that C-1200 section and look at how you really meet each of those explicit standards. And again, when we look at the state operations manual, it says, what was changed last year and new, all in red, but it also says to be determined. So we don't know what the expectation is, even though we are still being held to that standard and expectation. So within our nosocomial infections, these are things that we need to really think about with our last year. How did COVID really impact that standard at our hospital? What methodology did we use to evaluate our infections and medication therapy? What did our committee address on current issues and projects? Looking at our emergency preparedness and the influx of patients coming in. Did we have a tent out for testing? What are some of the things that we had to do different for our patients? And again, these are some older ones. I don't have any newer ones that also talk about the COVID impact, but you do want to think about that. One of the things that the one hospital here had on the right-hand side, the top 3 priorities and what their priorities were, and how they met those as an organization-wide evaluation. Patient care services, again, this typically falls on nursing. and how it affects patient health and safety. Some team questions to think about as we go through this. Who is responsible to evaluate patient care services? How are they evaluated? Are there any other services that are included? And then how does the hospital ensure that the quality assurance data is provided to the med staff and the governing body? And that is really just looking at that flow of communication, and it can be just a quick flow chart. And I think we all have those as how we communicate up and down throughout the organization. And then our provider quality and how our providers are being evaluated. Things to ask the team when we think about the providers, how is clinical performance of the mid-level practitioners evaluated? Did we change up a hospitalist during this last year? Add or remove any of our medical staff? Did some of our specialty services change because of COVID? These are other questions that you could ask when you're evaluating the med staff. And then any follow-up in our QA plan that kind of goes along with the whole evaluation process. And then we have our department and services. And with that, we really want to look at, what were our departments doing, the volumes, the activities, again, brief narrative and a graphic, very simple, and it speaks for itself. Any new or changed contracted services. And then obviously our patient satisfaction, not just our HCAHPS, but are we doing anything in our outpatient ancillary services, to capture patient feedback? And was there any variations to our strategic plan, which I anticipate there may have been because of COVID? Again, some more examples without graphs and what they had written in. Just looking at, if you have a hospital-wide department quality dashboard, it's easy to just plug that in as an appendix. Highlight 1 or 2 lines can be sufficient by department. It doesn't have to be robust. It just has to say, I evaluated it. Here's some patient satisfaction graphics that were in some comparisons. Again, just gives us a quick look at how we can do things. And then some other considerations that we want to think about. I know we probably didn't offer any health fairs last year, but what kinds of other community benefits or changes did we provide? Did we do any Meals on Wheels? Did we do any daycare so our staff could work? What are some of those other enhancements that we had achieved during that year? And then if you didn't do an executive summary, or even if you did and you want to add a full summary, it's the overall impact of your CAH program. Are we meeting the needs of the community? Any of our scope change? Overall improvements made or pending in the next year? Any steps towards new services that we've now identified? Did we align with the system? Did we get engaged with an ACO shared savings program? Any final goals and or expectations? Any surveys to happen during the course of the year? PCMH in one of our clinics or Joint Commission, and I don't think anybody was out and about last year much, but there might have been some that we want to tout on and say, hey, look at us, look what we did. And like I said, there's this Word document, and I'm going to go through these fairly quickly. But what I pulled together, and I did this for one of my other hospitals, and they really liked it. It was just, a quick visual for their team of who's responsible and how should I present the data? What looks good? Bar graphs, trended data, pie chart. Again, it's truly just informational. You can take it for, all it's worth, but it gives you some bullets to look at. As you start to go through the various areas, our significant events and economic factors, our revenue and expense analysis, some of our hospital activity, what happened, and then we start going a little bit further into, some of our clinics, our specialty areas. Did we change anything? And then, our active and closed medical record reviews, how we determined our 10%. And I would put that in just a notation on our annual review. And then some considerations in human resources. Did we have a high turnover rate, during this last year? As well as our community and market share. I think this is, definitely where we thrive, because of our communities. And we want to show what we were able to do, especially during such a stressful year. Obviously, our QAPI and infection control and our patient satisfaction, like we talked about earlier. And again, just an evaluation of our contracted services. And then, did we have any other things that we offer? Pain, wound, infusion centers, Again, did we have a COVID clinic? Did we have, a COVID drive-through? Looking at new service lines, closed service lines, or changed service lines overall. So now it's your turn. If you have any questions, I don't know if anybody really has any right now. So feel free to unmute yourself if you do. So again, these are just meant to be quick, down and dirty half-hour rollouts. Or if you would like any of this information sent to you, I will gladly send it to you. The recording will be on the Connected Healthcare Solutions website, along with the additional attachments of the PowerPoint and the Word doc for your use. So again, I hope you enjoyed this. Hopefully it's beneficial for you. And give me a holler if you have any questions. Again, I am Angie, Angie at canopyassociates.com if you need anything. Thanks so much. Have a great afternoon.